By establishing the Health and Wellness Alliance for Children, we have joined hands with valued friends and partner organizations throughout the community to make life better for children and families where they live, work, and play. These words were spoken by the CEO of Children's Health, Chris Durovich, and they signaled the beginning of a new century for this beloved institution and the community it serves. When the Health and Wellness Alliance for Children was established by Children's Health in 2012, we set an ambitious goal to measurably improve the health and well-being of children. We started our journey by facing some hard facts. Our kids are not healthy, and this is not acceptable. That's why the Alliance set out to tackle two of the most prevalent chronic illnesses facing our children and families: asthma and healthy weight management. These are just the tip of the iceberg, but guided by our expert partners and the voices of families themselves, we are making strides in the right direction.
So Children's Health has spent the last 4 years really listening deeply to children and their families, understanding their hopes, their desires, their challenges in their lives and in their communities. What they really want is a better life for themselves and their families. And we need to work within their definition of a better life in the context of their family and their community, rather than giving them a prescription and telling them what to do.
We learned that accountability and co-designing programs with families really works.
This alliance is going to do well, I believe, because they've got a lot of key people who have been accustomed to working alone and now realize that collectively we can do a lot more and make a larger impact in a shorter amount of time.
When we fuse hard data with the hands-on participation of children and families, we are moving the needle. Take asthma. From 2012 to 2015, asthma-related visits to the Children's Health Emergency Department dropped nearly 50%. There are many reasons for this, and the Alliance's role in convening just the right experts is among them. Alongside clinicians, community leaders, school districts, and government officials, we help create a standardized asthma action plan, as well as an asthma app for smartphones. We launched in-home asthma education through community promotoras, trained code inspectors, and facilitated Chapter 27 City Housing Code revisions. The Alliance is also convening stakeholders from both the private and public sectors, focusing on housing improvements to the Lancaster corridor area. All of these collaborative efforts directly support the well-being of our children and families. By aligning and integrating our efforts, Alliance partners can accomplish more than any single organization could achieve on its own.
When I was a resident training in Miami, I was looking after a child with asthma on the floor, and I realized when I was trying to discharge that patient that nothing could work right because they were homeless and they had to decide between a bed in a home and getting their prescriptions and following the instructions and the rules of the home. And I realized then that what I read in the textbooks in medical school was not enough to help my patients have better quality of life and have kids be free of chronic disease.
What I believe is important to this work is this unique approach that I think is very different for our community. It's not traditional. You might even call it radical.
When it comes to healthy weight management, Alliance partners recently completed a pilot project designed to help residents of Mill City, a food desert in Dallas County, get access to nutritious food. Alliance partners including Children at Risk, City Square, Food for Good, Brighter Bites, Hackney Food, Grow North Texas, and Bonton Farms worked together on this, and the collaboration resulted in valuable lessons learned.
The beautiful thing about the Health and Wellness Alliance for Children is that it is focusing a large part of its attention on what happens during the 8,750 hours out of a year that a child and his family or her family are living their lives and are not directly connected to the healthcare system.
To reach even more children and their families, the Alliance is now expanding into Collin County.
Well, we are definitely going to be using the collective impact model in our work in Collin County. I think the added dimension of human-centered design will make a much more robust and rich solution to the issues in our community, especially those facing our children and families. I've done a lot of collaboration and a lot of work bringing community groups together, and this is doing it differently.
We should all be excited for what lies ahead, and I want to extend my heartfelt thanks to our friends, our partners, our donors, and families for the momentum and the success that we have achieved through the Health and Wellness Alliance for Children.
And these thoughts are shared by the Honorable Mike Rawlings, Mayor of Dallas, who summed up our commitment by saying that the Health and Wellness Alliance for Children is a shining example of cross-sector organizations coming together with focus, grit, and determination to help make Dallas the best city in America for kids to grow up.